extra weight anywhere on your body is annoying, but really, is there anything worse than having a double chin? No matter how much you weigh, having a little weight in this area just isn't flattering. The only treatment for a double chin, other than losing weight, used to be liposuction, but now there's a new treatment for those who want to avoid a surgical procedure. It's something called Kybella.
I'm Erin Jensen, a mom of 3 wonderful kids and a dermatology physician assistant at Skin Physicians and Surgeons. I'm passionate about helping patients look and feel their best, and I'm excited to share a little bit of my world as a PA with you all.
Kybella is the first and only FDA-approved injectable medication to treat the fat under the chin. The main ingredient Kybella is a molecule called deoxycholic acid. This is a naturally occurring molecule found in our digestive system. What this molecule does is that it helps break down and absorb the fat in our stomach. So what they've done is they've taken that molecule and made it into a medication that we can inject into fat cells that we want to target and make go away. Kybella causes the destruction of fat cells. So once those fat cells are destroyed, they can't absorb fat anymore and they're gone permanently. So if you gain weight over time, you're just going to gain in another part of your body. It's not going to go to your chin. What we do is that we first anesthetize the skin with a little bit of topical lidocaine about 20 minutes prior to the procedure. We then have the patient ice the area for about 5 minutes before we start. We then clean the area and we place a grid on the area that we want to treat. What this does, it ensures that we're injecting the Kybella directly where we want it to go. We're not putting it into other areas. It's a very simple procedure and only takes about 2 to 3 minutes to perform. Once the treatment is over, most patients will experience mild swelling, burning, and a little bit of numbness under the chin. But don't worry, it's temporary. It only lasts about 7 to 10 days. So who's a candidate for Kybella? Anyone with a little extra fat in the area is a good candidate. What we want to make sure you don't have extra loose skin in that area. If you have too much loose skin, Kybella just isn't going to be effective. So something like a neck lift or a lower face lift might be a better procedure for those patients. A vial of Kybella runs about $700, and the average patient needs anywhere between 1 to 3 vials per treatment. And depending on how much fat you have, you may require 1 to 3 treatments to see optimal results. Today we're going to be doing the procedure on our patient Laura. She's a mom of 2. She recently lost a lot of weight, but she's having trouble losing that extra little fat right under her chin. So the first thing we're going to do is that we're going to find the areas that we want to treat. So right here with our patient, she just collects a little bit of fat here. With this white pencil, we're going to draw out the areas that we want to treat. So Kybella will destroy fat, but it also can destroy other things like skin or nerves if you put it in the wrong areas. So there's some areas that we don't want to treat with Kybella. On the jawline, you have a nerve right here called your medial mandibular nerve, and we don't want to inject it right there. So we're going to keep it right down here in this little pocket. Okay, this is going to be the guide that we're going to work with. So what we do is that we're going to apply a grid onto this area, and it's going to show us exactly where we want to inject the Kybella. Okay, this is the grid. We're going to apply it right under the chin area. It's almost like a little temporary tattoo. You'll see it comes off right after the treatment. We're just using a little bit of sterile water, and this just goes on like any temporary tattoo you might have used when you were a little kid. Everybody has a different amount of fat under their chin. So depending on how much fat you have, it depends on how much of the Kybella we're going to use. And you can see it's made a nice little grid, and we're going to inject the Kybella right around these little dots. We've measured out the area, we put our grid on, we're going to count how many dots are inside this grid, and that's how we're going to know how much of the medication we're going to use. So what we're going to do, we're going to grab the area where she has her fat, turn this way towards me a little bit. We're going to find the little dots where we're going to inject it, and then we're going to put 0.2 cc's of Kybella right next to each dot. We're not going to go through the dot, we're just going to go right around it. Are you doing okay? Mm-hmm. Good. So we're just following our pattern. This grid ensures we're putting an even amount of medication into the area we want to treat. So that way the fat dissolves evenly. We're getting nice even results. All right. Easy as that, we're all done. So our treatment's all done. Does the area burn a little bit? A little bit. So So what we do after Kybella, it does burn for about 5 to 10 minutes after the procedure. We'll put a little ice pack on the area. It makes the burning a lot more comfortable. But that's it. The treatment takes less than 2 or 3 minutes to do. It's a very straightforward, no downtime procedure. The patient can go back to work, go back to her family. There's no downtime with it. We're gonna apply a little pressure bandage around the area to help decrease the swelling and the inflammation. That will help reduce the swelling because it's normal to get a little swelling after the treatment too. We see the final results after about a month. I hope you enjoyed this video. For more information about Kybella, visit our website, skinps.com, and make sure to subscribe to Dr. Pimple Popper University for more procedures like this.